Join me for a crash course in how to keep your back healthy, reduce back pain by working through your pelvic floor and using tools in your daily life to help support your pelvic floor and support your low back in preventing and decreasing your low back pain. I'm Dr. Allison Felt, and I can't wait to give you this information. First thing I need you to know is that if you have low back pain, you have to not just address the low back, but you need to look at what's happening below the low back and above the low back. So that means what's happening in your pelvis and what's happening in your mid back and in your neck, because this is all connected. It's all a system. And so much of the time we see people that have chronic low back pain or just persistent low back pain, and they have such issues within their pelvic floor that once we address the pelvic floor and heal the pelvic floor, they no longer have low back pain. This is a very common situation, and I want people to know a couple tools that they can integrate into their daily life that is going to help take the pressure off the low back and start healing their low back once and for all. The very first thing we're going to do together is called diaphragmatic breathing. This type of breathing is done to help open up the pelvic floor and open up the entirety of the core. A lot of times when we have low back pain, we're bracing constantly in order to help protect the spine. That can create compensatory patterns in our body of tightness and restriction that further exacerbate the low back pain. Here we are doing a diaphragmatic breath. You're going to take a nice deep breath into the belly. Imagine all the air going into the belly. Exhale and let it go. On the next inhale, I want you to think about opening vagina, opening anus, thinking about bringing all the air low, low, low. We're releasing and opening our pelvic floor with this breath. Exhale and let it go. Inhale again. Opening pelvic floor, opening belly, allowing the air to expand and stretch out the core, which is going to take some of that pressure off the low back if we can get some more movement through the entirety of the core. Letting it go. That is your diaphragmatic breathing. I want you to do that 5 minutes a day to help take the pressure off your low back and work on expanding the core to new lengths, which is going to make it stronger in the end. Next, we're going to talk about how to get in and out of bed if you have low back pain. If you have low back pain, you want to avoid crunching up out of the bed and then lowering yourself back into the bed like this. Well, how you want to get in bed is, if this was my bed, you're going to simply roll to your side. Your elbow will help support you. You're going to bring your legs up, trying to keep your spine totally in alignment. Then you're going to lower yourself to the bed, and then you can work your way either to your back or to your other side. To get to your back, what you would do is you would straighten the top leg. You're going to use the outside of the right foot to push yourself to your back, and then you can straighten your legs here. If you want to get back to the other side, you're going to bend the knee at which you're turning to, and then you're going to bend the other knee, and you're going to push with your heels and turn yourself over. Now you can also do a variation, especially if you have any pain on the front of your pelvis, to just straighten this leg and then push with the outside back of this leg. So you're gonna find what works for your body. You can help support your body with pillows here, using a pillow between the knees, underneath the neck, or holding a pillow. Body pillows are great options for this. Then when we go to get out of the bed, we'll drop our feet over, push up with our elbow, and come back up. Again, we're avoiding the sit up and the crunch, because the sit up and the crunch can put a lot of pressure through our discs, which, if we have any underlying disc herniation, can put more pressure on the nerves. And we want to make sure that we are taking the pressure off the spine and off of the pelvic floor. When we get in and out of bed like this, you also take the pressure off the pelvic floor. Now, here is a breath pattern that I want you to implement when you move your body in space. So when I go from sitting to standing, I'll tighten my lower abdominals, and I will do a shh exhale sound. And that is then helping decrease the pressure in the spine. And so if you add in all these movements into your daily life, you're going to end up with a lot of improvements in taking the pressure off of your back. I hope you found this information helpful. If you are dealing with low back pain, I want you to make sure that you see a pelvic floor physical therapist, someone that can help you take the pressure off your back in through the pelvic floor and through the pelvis. And then also looking at the mid back. All of these things attach attached to the lumbar spine, attached to the back, and need to be addressed. And so if you have chronic low back pain and you've never explored what's going on in your pelvic floor, this is the solution to healing your low back pain once and for all. Heal your pelvic floor, heal your low back. It's all connected and it will make massive improvements in your life. I'm Dr. Allison Felt. Thank you so much for joining me. Please like and subscribe to this video and share with all your friends that have low back pain. Take care.